Hi everyone, it's Tower here. Today I wanted to talk to you about how hormones affect our skin and specifically how hormones can regulate acne in our skin. So basically, when we have hormonal related acne, it happens during specific phases of our lives. So when we're teenagers, when we're going through puberty, and you tend to get a lot of acne sort of specifically around your T-zone area, or as you get older and you have acne that comes up during menstruation for women or during the menopause, or when you've got things like polycystic ovary syndrome, where you tend to get more acne around the lower face, so kind of across the cheeks and the jawline, and a lot around the mouth area. So you get around 50% of women in their 20s that have acne, and usually around 25% of women in their 40s and beyond that suffer from hormone related acne. So it is quite a major problem for a lot of people. So really, the way that hormones typically regulate acne, you get a group of hormones called androgens, of which one of the most important is testosterone, which a lot of people think is a male hormone, but actually it's generated in both males and females. So testosterone tends to increase the production of sebum, oil, in our pores, our hair follicles. And that starts a chain reaction of acne, as I'll talk about at a later point in the video. Other hormones called estrogens tend to decrease the production of sebum, and they tend to be in balance, the androgens and the estrogens. But as we enter things like menopause or menstruation, that balance becomes unbalanced effectively. So you get more of the hormone testosterone than you would have of the hormones estrogen, and that affects how much sebum or oil your skin produces. So that then starts off that chain reaction that results in you getting acne. So I'll talk about that a little bit more. So basically, even when you're having HRT during menopause, you might think that that would actually reduce those symptoms, but actually some of the hormones that you're given as a replacement can again stimulate that chain reaction of acne proliferation. So basically, when you reach that tipping point during menopause or during menstruation, or if you're having an outbreak of PCOS, the tipping point of androgens versus estrogens becomes imbalanced, weighed in favor of androgens, the testosterone type hormones that tend to stimulate more oil in your skin. That oil clogs up your pores, your follicles, combining with dead skin cells that don't get turned over as often as they should because we're getting older. It's a bit of a triple whammy. So you end up with clogged follicles that a bacteria that resides on our skin normally and doesn't really do anything most of the time. It's called P. acnes bacteria. But when we get these clogged follicles, the P. acnes bacteria proliferates and it just expands. You get loads and loads of P. acnes bacteria all over your skin, and then your immune system kicks in and starts to attack the P. acnes bacteria, and you end up with this inflamed, angry looking skin, as well as the clogged follicles, as well as the pimples that are the result of all of this activity on and underneath the surface of your skin. So that, in a nutshell, is how hormones affect our acne regulation. Now, what we can do to actually change this and to address this, the very first thing is to consult with a skincare expert. Don't try and self-diagnose or self-medicate. There's a number of factors that go into creating this acne breakout on your skin, and there will need to be a number of factors that need to be used to address it and to regulate it. So always in the first instance, speak to a skincare expert, get a comprehensive consultation that talks about your skin, the products you use at home, your lifestyle, your exposure to the elements, all sorts of different things that will factor in to what kind of treatments will be best suited for you. And you will need to have different treatments. It needs to be a multifactorial approach because one treatment isn't going to deal with all the different sources and issues that the acne causes that I mentioned earlier on in the video. So be prepared to have treatments that will include lots of different angles. So the kind of things that you can expect to see in your treatment plan will be, for example, prescription medications. So it could be things like anti-androgen hormone medications like spironolactone that will be prescribed for you to try and reduce the level of that testosterone further and thus regulate that oil production. It could be things like retinoids like tretinoin or adapalene to try and increase cell turnover, to make sure that your skin, the dead skin cells, are being sloughed away from the surface of the skin and don't contribute to the clogging that you feel or you can see in your pores. It might be antibiotics like clindamycin to try and target the proliferation of the P. acnes bacteria and reduce that source of inflammation that causes so much problems. Should also be looking at dietary supplements. Things like omega-3s and probiotics and prebiotics can help to regulate the bacteria. Gut health is intricately linked to skin health. So by regulating the flora and fauna in your gut, it will have an impact on the proliferation of that P. acnes bacteria on the surface of your skin. You should also look at your diet. Although it's an old wives' tale that eating chocolate gives you spots, there is an element of truth to reducing high glycemic index foods and dairy, because eating lots of those foods tends to increase the levels of another hormone called insulin in your body. Now, while that hormone is typically associated with conditions like diabetes, the receptors for insulin in the skin are also very similar to the receptors for testosterone. So increased levels of insulin will actually mean that your hormone receptors will be tricked into thinking there's increased levels of testosterone, and so they will increase your sebum production as a result. So therefore, reducing the levels of those foods reduces the levels of insulin in your body, and it reduces the amount of receptors that think that there's lots of testosterone floating around in your skin, thus reducing the oil. It is a chain reaction. As you can see, nothing in the body is simple. Everything is complex. So reducing your amounts of certain foods, high glycemic index foods, so basically carbs, the nice things, the bread, the chips, the pasta, all of those things in moderation will help to regulate your acne. And then think about clinic treatments when you speak to your skincare expert. Think about things like chemical peels, so using acids like alpha hydroxy acids like lactic acid to superficially exfoliate the surface of the skin, as well as beta hydroxy acids like salicylic acid that go deeper into the pores to clear out that excess congestion. That will all have an effect on reducing the availability of the P. acnes bacteria. Also think about things like treatments with IPLs or LED lights, so light treatment to actually again kill off that bacteria on the surface of the skin. That's been proven to be really effective in the treatment of acne. Also things like microneedling, because they actually stimulate the skin to heal and they induce an inflammatory reaction that kind of covers up the reaction of the skin to the P. acnes bacteria. And then finally, skincare, because there's no sense in doing all of the above, going to clinic to have treatments, having your prescription medication, and then doing nothing else at home. You need to have skincare so you're targeting the acne every single day. So think about the kind of ingredients, active ingredients, medical grade ingredients that you need in your skincare. Things like retinol to increase that cell turnover. Things like the alpha and beta hydroxy acids we spoke about earlier that can be used in both skincare at home and more potently in clinic treatments as well. So think about other things that you can do to exfoliate your skin, to make sure that you're cleansing your skin and reducing oil production. Things like mandelic acid in your cleanser, for example. All of these things combined with your treatments in clinic, with your changes to your diet, with your supplements, with your prescription medications if you need them, all of them need to be considered to enable you to tackle the acne proliferation properly. I hope this has been really helpful, but if you have any other questions, then contact me, TD Aesthetics, on my social media channels or via my collaboration with the Skin Collaborative. Myself and all the other members are more than happy to speak to you about acne at length and help you get on the road to clearer skin. Have a wonderful day. Bye for now.